And it's really also for me nice to see the different stories. For example, 11.6 on the femur, respect, or 3 times the surgery. I mean, close to 30 centimeters, really respect. So, and I thought I'm like the guy who have the record and 3 limb lengthening surgeries. But when I see you guys, it's like just, I have respect. Hello guys. So we did today an amazing roundtable with amazing patients. So before you watching this roundtable, I want to say some words about that. First of all, the reason why we did the roundtable today is not to prove anything, or to show people that we have a lot of patients, a lot of quadrilateral cases. So the goal here is to see the different stories and the different cases of different international patients. So you have to imagine there are a lot of patients here. Of course, not all of them is showing his face or sharing his journey. So first of all, thank you for all the patient who's sharing his journey. That's really important, and also helping other patients as well. So you have to imagine there are different patients, different goals, different dreams, different fates, different experiences, and different methods as well, because we are always saying the patient is different. The method is the same, the surgery is the same, the team is the same. So almost everything is the same, but what different is the patient self. So, and the goal here is to see that with real patients, because unfortunately, this is in the whole world a missing part of this kind of surgeries. I mean, so when you check on internet, you cannot really see some real stories behind, for example, so who is the patient? What was the method? How was the experience? Did he reach his goal? Because at the end of the day, it's an investment, and the investment should be worth it. And then also, what happened to this patient later? What happened to him? Did he remove his nail? How is his walking? How is his running? Also about complications. So, and our goal was always to share, be honest about different stories and different patients. Of course, not with all of our patients. We have to respect also patients who want to keep his privacy. So, and but with the patient who is okay with that, so it's such a great opportunity also for you guys to can see that, because unfortunately on the internet there's a lot of negative comments about the limb lengthening surgery, especially about people who never did the lengthening surgery done. So all of them has a feedback, so because of some content, but they never did it, And also we have some negative patients or super positive patients who's talking really good or really bad about the surgery. With this roundtable, you can see the patients who reach different goals, even more than 20 centimeters, close to 30. You can see patients who came for the 3rd surgery to us, or you can see also complication cases, or you can see what happened to him after a year. So that is the goal here. And so with real patients who is finishing the lengthening or who is still in the process, so, and not some dry comments on internet without any proof or evidence, so which you even don't know, is it really the patient or not, or is it a fake account or not. So the goal of Livelifetaller, that was also an important point why we created this place, because you have to imagine that was always my dream to become taller. So, and yeah, that was my biggest dream in my life, because I knew that I just live once, and this is not as a short man. So, and I promised to myself, so once I'm done with that, I will be honest and post also everything and share everything honestly. Yeah, and thanks God, we are in that point which we can post a lot of different cases. For sure, the surgery, it's not super easy. It's not an easy process. I mean, for me, it's nothing easy in this earth. So you have to fight for everything. Sometimes you have to fight more. Sometimes you don't need to fight that much for some other goals, But at the end of the day, you have to fight. So you have to show, and you have to fight, and you have to believe in it. And yeah, that was also my case. So I knew that that was my goal, and I did it. And I'm so happy, and I'm glad to can show also to other patients, hey, look, this is a life-changing surgery and is worth it. So, and also my goal is to show you guys about this side of the limb lengthening surgery. Not everything is perfect for sure. We have also complication. I mean, I think we are also the only place who's sharing a lot of videos of patients and journeys, and who share also and talk also about complication, because complication is a part of the journey. Everybody's different. The most important thing is to stay behind of the complication and to have the enough experience to fix a complication. So how you can fix a complication if you have experience, and how you can have experience if you have complications, unfortunately. So, and yeah, that's the most important thing. Problems is there to be solved, as long as everybody stay behind us the problems. So very important, dream should be not only a dream, you should make your dreams come true, and never let you stop on dreaming, or never let you stop to make the first step, because this is what makes us people so special, right? So dreaming and to make the dreams come true. Yeah, so, and also do not believe in people who never did the surgery done, or who don't have the experience about limb lengthening surgery. I hope you enjoyed this video, and if you want to see more videos like this, please write in the comments. Guys, welcome to our great video. So I'm really blessed to see like such a great people here, our patients. So by the way, all of them is doing quadrilateral, right? So except me and you, bro. So you did the long femur. I did 3 surgeries, but like not at the same time. I wish I could do it at the same time, but my medical background so didn't allow me to do it, unfortunately. So today the goal is just to listen from different patients' view and the stories of them. So because everybody is different, every experience is different, the dreams are different, the reason why they are here is different. So this is not just a video to show there's a lot of patients here and we are doing marketing. So the goal here is to see the different stories here, because there are a lot of questions to me, like which method is good, which is better, which method I can recommend to them. Is quadrilateral good or not, you know? Or how is the pain, how is the surgery, is the surgery risky? I mean, I have different great people here. They are doctors, they are, you know, like businessmen, and they know personal trainer. I mean, they know exactly what to do in the life. That's the reason why you guys are here. And you can pay for a quadrilateral lengthening. So, and yeah, so this is the goal today. I mean, before I ask you the questions, or before we start to talk, I have Damian here, bro. Welcome back.
Thank you.
So, I mean, everybody knows you. So,
I hope for the good reasons.
of course, for sure, bro.
But yes, very happy to be back in this place that I spent many months in. So yeah, it brings great memories, and obviously it was a very transformative journey. So I'm very glad to be here and to see you, to see Sarah, and to see everyone here.
I appreciate it. Thank you, bro. So yes, we can start. So all of you guys is doing quadrilateral. My first question, just by the way, we can also talk random. So how is the experience here?
I'll go ahead and start. Well, I'm the only patient that's not a quadrilateral at this time. So bilateral, so doing just the femur fitbone. So far, my experience has been phenomenal. I say phenomenal. Literally, I don't feel anything whatsoever. I feel the pain on my feet. That's residual, little bit of nerve pain from the previous operation. That's other than that, I'm really happy. I want to say that I don't know if it's just a blessing in the sky for me, but I've never had any issues. Not with either one of the operations. As everyone knows, I did the quadrilateral last night. I agreed. See, didn't have a see problem or complications later. I'm just very happy. I know this sounds like a Cinderella story, but this is the truth. No problems with the LM, no problems with the precise too, and now no problems with the
I mean, that's crazy because we did the LON on your body, right? The precise and now the Fitbone. I mean, you are the ones, we did 3 different methods on you, right?
You are a true tester. You've tested all the methods.
Yes, I am the only patient that has done all 3 procedures successfully so far. Huh?
I mean, you are really lucky, by the way, so no complications at all. So by the way, Carlos, which method would you say was the best?
Well, it's kind of a question because, as I said, I didn't have any problems with either one of the methods. It's just kind of hard for me to say, okay, well, I prefer this one over the other one. I want to say though that it's a battle between Fitbone and Precise because I definitely did not like the idea of having the fixators on the outside, even though I didn't have any problems. But if I had to pick between the 3 at this point, I'd want to say Fitbone, without a doubt. Okay, it put aside, I did 0 leaks, 0 problems. So and you know, Marek, I think you're a witness that I actually can stand up without any assistance whatsoever. So that was proof that the Fitbone is not only a good nail, but it was definitely strong enough to pull somebody away for another 20 hours.
Wow. I mean, so you are a good example, definitely the good side of the limb lengthening surgery, right? So for example, when I will be a patient who's a man who's interested in limb lengthening, and once I saw your story here and your explanation, right? So then I will decided to directly go for the limb lengthening surgery. So you are, the good side of the limb lengthening surgery, but I mean, not everybody's so lucky and no complications, right? We have, for example, also a complication case, for example, Quag. So you had complication here. So can you explain a little bit about your story?
Yeah, some people find it like looked at, but and that's barely what they come in, right? So when I have a CrossFitter, so I've been doing CrossFit for 13 years, and I work out 5 to 6 days a week, and I play pickleball 2 3 times a week. So I'm pretty active and fit. So I thought I won't get too many complications, but I had some complications, right? So and I learned that part is genetics, right? Part I'm older, right? So I'm 50, so maybe that has something to do with it. But like, the issues I've had is that my bone density is very thick, right? And also my bone canal is very small. So I had 2 complications. So I think what happens like when Dr. Ville was drilling here and this side to pull out work, and he said that I was like 1 out of 1,000 patients. He said it's just so much work. He says usually I'll do 3 surgeries and then I'll go home and juice my buddies. But he said after your surgery, I had to go home getting that. Like there's so much work just drilling. So he said that something that drew through the bone canal take 4 times, but yours takes like 50 times. So because there's so much chop on this side, what happened was that after my surgery, I had to, I was in a lot of pain and I had to overcompensate because this side was so much pain that I was doing a lot on this side, leaning more to this side. So one night I was just brushing my teeth and I felt click and screw thickness. So I had to do a second surgery. So that took another 2 weeks to recover. And now it's doing good again. And then after that, but during that time, because this side was weak first, so then I started focusing on this side. And this side became weak, so I was focusing more on this side. So then in the 2 weeks after that, I was just stretching, and they told me these x-rays, and when they looked at the x-rays, they found out that I had done a bone fracture of my tibia. So they had to do the 3rd surgery that just finished last week. So I've had 3 surgeries. So I've had some complications, but so it's not been the greatest and it's just pain, but so far I still don't regret. I think right now I see the finish line. I'm so close, And I think I'll get about 5 centimeters. I mean, 5 inches, which was my goal. So I still don't regret this decision. And it's so great that, like what you guys said to all your videos, that any complication that happens, it gets fixed, is covered, right? And that is big, where you don't have to worry about it, right? Where you look at other places and you're at home, I can't imagine what it'd be like being at home and a complication happens. Like, when you go to see a doctor, how's it get fixed? Who's going to pay for it? He was just taking care very, very quickly. So, I mean, I really appreciate that.
Thank you, bro. So, and still with complication, you can reach 5 inches.
5 inches, yes.
That's amazing. And how was the pain overall for you? Like,
the whole process has been pretty painful. Like, I know I was watching all these videos before, and they was talking about it's just discomfort. It's not really pain. I feel pain. I had a back pain. So, like, I have a lot of issues like sleeping at nights at night. Like, I was just hospital to you. So, like, most of the nights I'm not sleeping until 5 a.m. And I'm sleeping from 5 to like 8:30. So it's 3.5 hours. Because when you do quadrilateral, you'll learn that every 2 hours that decently, right? 8 o'clock waking, 10 o'clock, 12, 2, 4, 6, 8. So I don't wake up a couple hours to sleep. And then just after every surgery was pretty painful. So I remember like learning to walk again. It was painful. So there's pain. But you just focus one day at a time. Let's get through it. And I realized that love is mental. I can't tell you how big mental hard it is. And also the community is really nice. Because we hang out all the time, most of us. Like, Crow is not, you're like always playing parts, having meals together, go to the gym together. That really helps, having the community for us to spend time and support each other. Because this kind where I'm now, she helps me. She's down, I help her. Like, there's so many times that we discover each other as a triple.
I mean, that's crazy, right? So he's telling me no pain. You are telling me really pain, even not the discomfort. So that's what I'm saying. It's like everybody's different, you know. So every reaction is also different. So, and yeah, thank you, bro. So I'm really happy that you feel good and you are able to reach your goal anyway, you know, because you are investing in yourself, and that should be also worth it. And I'm really happy for that. So our famous patient, Michael, brother. By the way, you are so famous. You and Carlos, by the way, so even my personal trainer is talking. Like, I'm doing sessions with him, you know. For example, yesterday was my leg day. So, and we was just talking about you and about you. He was telling me, hey, he's looking really natural. So like, I mean, I cannot see any like differences, you know, like his arm length, torso. Bro, you are looking really good. Yeah, he's tall, but you look also really proportionally. So, but by the way, like this is also a really interesting question, because people asking me, you know, Damian, like they want to reach 8 centimeters, but they are afraid about to not look proportionally. Like they thinking like they will have small torso, small arms, and super long legs. Like some people are also like posting some videos, like, you know, just funny videos, but it's not like that. I mean, he's a good example. He did octolateral, so as you said, right? And can you talk a little bit about your story, bro, and also that what happened to you also?
Well, I've done a lot of surgery here.
Yeah.
So the long story short is 2 years ago, as you know, I did my first quadrilateral. That was PRECICE. I did 6 inches on that, 15.3 centimeters. And then 2 years later, now 2026, I did another 5.5 inches. So 14 centimeters clean on the second quadrilateral. So the goal for this second quad with Fitbone was 7 to 10 centimeters, and my condition was good, so I just kept going. And I hit 14 on the second. It's a long discussion, of course, because the radiographic augmentations are not the same as the vertical height. So I got 14 on this second quad. Maybe it's 13.5 in real life, 15.3 on the last quad. It turned out to be 14.5 in real life. But what I can say is, if we go based on the x-rays, I started at 171 2 years ago. That was a little over 5'7". Now I'm 199.5, which is over 6'6".
Wow.
And the reason, once again, without telling my life story, I mean, the reason I went for 199.5 is because 6'6" is 198.2. And I wanted to clear it on x-ray so that I know that when my condition is good enough, when I've improved, I can be barefoot and say, no, I'm confident I broke 198.2. So Yeah, so I've gone through PRECICE, I've gone through Fitbone Quadrilateral. I agree with Carlos that Fitbone is better than PRECICE. I think all of us could come up with a list of things we like, what things we don't like about each method. So overall, it's results, obviously times of pain, times that are a bit less pain, different cycles and phases. And, you know, and as Kwok was saying, the social atmosphere here, there's times you can decide to socialize more. That can help psychologically. Times you might be more reclusive and you just want to focus on your lengthening. And of course, all the staff here, they're going to help you through the process, multidisciplinary with the nutrition and different aspects, the medical team coming, nursing, they check on you. So yeah, so overall, as I said, 171 to 199.5, and I hope to be out of here within the next couple of months.
I mean, you're a doctor as well, Michael, so what is your experience about the limb lengthening surgery? What you can say about a doctor, so medical doctor, you know, so yeah.
I mean, people are going to have varying opinions. It depends on the individual patient and their condition, right? I mean, as you know, you see a variety of patients, young and old, who some, they have very fast bone healing, right? Sometimes they have slow bone healing, or sometimes patients get neuropathic pain, the nerve pain. Other patients don't. Some patients have really good flexibility. I saw a video where you had some guy in the room with the orange wall doing a split. You know, some people have poor flexibility. So you're going to go based on each individual patient. And then in terms of more of a general statement in limb lengthening is that, you know, it's a difficult surgery and patients just have to be aware that there's risks and it's going to take time and there's going to be pain involved. But that's ultimately what makes it valuable, that there's sacrifices, but we are looking to achieve big goals.
Okay, thank you, bro. I mean, Michael was a patient from the beginning. You exactly know what you want. So, I mean, for example, we never talk about, we talk about the details, but you never ask me, can I be the same person as before? Can I run? Can I walk? Because he knew exactly before, right? So, but for example, with you was not that case. So, Jolene, you're a personal trainer, right?
Yes.
So for example, you was really worried about that what will happen after the limb lengthening surgery, so isn't it? So like, can you walk? Can you do the same what you are doing now, and all those questions?
I mean, basically, my main thought was, will I be able to do all the running, walking naturally after I was done lengthening? So I'm not there yet, but so far, I mean, through the process, I did the Fitbone quadrilateral surgery. It's been very smooth so far. I think what helped my journey a lot was, I mean, not only that I'm a personal trainer, before I did the lengthening surgery, I have done a lot of stretching, and you know, for the past few years, just, you know, my quads, my calves, my hips, I usually stretch those muscles, you know, periodically every day. So coming into the surgery, I didn't know what to expect. I didn't know how I was gonna feel. But after the surgery, you know, you go through the surgery, you wake up, and you're in a little bit of pain. First day was kind of tough walking, but after that, the second day I kind of recovered very fast. I just kind of, you know, went to the bathroom. Was like, oh, it's not too bad. I walked to the bathroom, and then the third day I just was like, oh wow, it's kind of progressing. I'm feeling more stronger. I'm getting more confident. Then I met the PT team, and they were making me feel very welcome, very great, as well as the people I met that has done the surgery made me feel great. So, you know, so far I'm at 11 centimeters right now. I can walk really well still. I don't have too much pain. Maybe sometimes at the nighttime, but so far I'm very happy with how the procedure and how everything has been going. So just want to be consistent with all the exercises, all the stuff I do with the PT, and just do, you know, what you guys told me to do, so I could be at my best once I leave.
Okay. The goal was before, when we was talking, before the surgery, the goal was 10, right?
No, the goal was like 13.
Okay.
Or 10, you know, 10 at least. I didn't.
You told me 10, I guess.
To be honest, I didn't know what to expect. I didn't know if I could reach 10 or 13, or if will I look like what you were just talking about, will I look disproportionate? But when he checked out my wingspan, it was about over 6'1".
Yeah.
So then I was like, oh man, maybe I should go for 14 or 15
Okay.
centimeters so I can match up my wingspan. So
Okay.
that'll look more proportioned. So yeah, kind of now that I'm at 11 centimeters, I feel great. So I'm thinking like, why not try to go for more centimeters, the max then,
Okay.
you know, so yeah, I feel confident doing that.
All right. So, and Dr. Right?
Yeah, so I didn't come here with quadrilateral in mind. I came here in my mind that I was going to do the LON on the femurs. And then after my, consult and wingspan and proportions and things of that nature, and getting a better understanding of the different outcome that I could expect from quadrilateral, I decided, then in that moment that the quadrilateral would probably be the best approach for me. I'm still kind of early on. I think I'm a little over 6 centimeters so far. I said to Sedat earlier that the physio team and the medical team, they're the superstars here. I mean, they're absolutely amazing, very encouraging, but they also hold me accountable to making sure that I'm getting the best possible outcome. I can't say that I've had a lot of pain, thank God. Some discomfort and some tightness, but I can't really say that I've had a whole lot of pain. But I found for me, what helps me is the hydration, drinking water like I'm a fish.
Wow.
The nutrition, I think that helps a lot as well. Attending the physio sessions, doing my exercises, the community here. There are a lot of people here that have gone through this before, much further in the journey than I am. And so the supportiveness of the community is kind of, I think, what has made it really valuable to me so far. Goal-wise, anywhere between 13 and 15, I'll be, satisfied with, anything for me is going to be a boost. So anywhere between 13 and 15, I think I'll be satisfied.
I mean, I'm sure that you can reach easily your goal, bro. Yes. By the way, you are a medical doctor as well, right?
I'm not a medical doctor.
Okay.
Yeah, at PhD.
Okay.
Yes, PhD. Yeah,
But you are a doctor. Okay. All right. Now we have Nan here. She's also doing quadrilateral. So, Nan, what is your experience? How do you feel? Can you explain that from your side, please?
I think I have to say that I have a lot of pain. Every day I do have a lot of pain, and it affects my sleep, my eating, so I lost some weight. And I've been here for almost 4 months. So the lengthening, the limb lengthening period is a lot longer for me because I started off as 138, which is like my muscle is a lot shorter, everything's a lot shorter. So I did expect that it's going to be a lot tougher for me compared to other patients, but it is a lot tougher than I imagined. But overall, I'm almost done. I only have 1 more week left, so I'll be 14 centimeter.
14?
14,
wow.
Yeah.
That
which
breaks
is
the world record, right?
Wow.
For any female, right?
not
I mean,
world, but
we had over 15 even, so, but it's not very common, Wow, 14 is good.
For women?
for
for
women.
women,
Oh, okay. And coming in, I just thought, I want the, because I wanted the loans method, LON method, so that I get 10 on top, and then I get 6 at the bottom, so I get 16. And I didn't think about like proportion of my body, so I was only 138, so 10% of my height would be 14 centimeter. So that's a lot. Like, if someone's 160 or someone's 170, 10% is 16 centimeter. So 10% is already a lot. So I should think about proportion percentage rather than, 15 or 16, because that's really hard for my body. It's like, putting your body through this is a lot of stress. Every day is, lengthening is a lot of stress, so you have to think about what you're putting your body through. But, it is the goal you want. I wanted this and never regretted it, except for days when I'm crying in pain. But then, the next day I'm like, this is where I want to be. And by next week I'll be 14 centimeters, so I'm pretty wrapped.
Okay, the goal is when you will stop the lengthening?
Next week, so end
Next
of
week.
next week. Yeah, so 14 centimeter.
Okay, you will stop at 14. Okay.
Yeah,
So
I'm happy
can you
with
also
14.
explain why we did the LON on the femur and the Fitbone on the tibia?
I think it was because Dr. Halil didn't say much, but I think it was because my tibia is too short. So I don't think they can fit the LON on the bottom.
Yeah. So the problem with you was like, for example, the Fitbone wasn't suitable for the femur. So that's the reason why. So we didn't like just the option like to put the Fitbone on the tibia and the LON on the femur. So because the femur was short. But now, for example, if you want to do another surgery on your femur, let's say, so then is the Fitbone definitely suitable. Now we have long femurs.
No more surgeries.
Of course, yeah,
Yes,
of course, sure. I
once
mean,
and only.
once you're happy, no more surgeries. All right. So now my question to you guys. By the way, bro, I come lastly to you
waiting,
because
yeah.
you are the joker here. I mean, he's a patient. Like now he can do everything, right? So my question will be later to you. So here's the question to you guys. So the quadrilateral lengthening, because I remember you was thinking first to do the femur. So Michael was from the beginning quadrilateral. So Carlos also from the beginning quadrilateral. Kwok also quadrilateral. Nan also was just coming for the femur. So I recommend you the quadrilateral and also to you remember? Yeah. So I mean, I did not the quadrilateral, I did the femur, tibia and femur again. So actually it's tough, you know, it's like a surgery, and for me it's a surgery not funny because like it's a surgery at the end, anesthesia, surgery again, the whole process again. So be honest, the quadrilateral, is it something which you would do it again, or is it something which you would recommend, or would you say, I will like, if I can do it again, just the femur first and then the tibia? So yeah.
I would do it again, one, because I feel like my proportions are going to be more balanced out. Second, you can check off them centimeters a lot faster if you're lengthening 2 limbs versus if you're lengthening 1 limb. You know, I'm just a few weeks in and already a little over 6 centimeters. That wouldn't be the case if I was only dealing with my femurs. And so I think from a proportion standpoint, and then honestly for a value standpoint, like we talk about return on investment and getting the most bang for your buck, I would definitely do it again.
And I think also because you're going to have viewers who want to max out their centimeters, which is the whole conversation about should you do a quad all at once or should you separate out femur and tibia to net another centimeter or two. And now we've got the discussion point as far as, well, for those of you watching who want max centimeters, you can just do 2 quadrilaterals. So rather, if you're watching and you say, well, I might do femur, come back later, do tibia, maybe do what Sedat did, come back again, do femur, you can just come here, do a quadrilateral, wait 18 months, do a second quadrilateral. So I believe I'm the first person at the clinic to do it.
Yeah, absolutely.
But when I was here doing my first quadrilateral, I was already telling other patients that I was going to do a second quadrilateral. Like, this wasn't something that I went home and thought about. Like, I knew from the start I was going to do 2 quadrilaterals. I was even telling you from, you know. So I just say that for people watching that want to max out their centimeters, that that's an option, that you can come here.
I mean, you are definitely a hero, bro. So you are a different story, man.
I mean, that was a really tough decision. When I was going back and forth with you on WhatsApp, I was thinking like, I'm not sure if I want to do the femur or quadrilateral. And they're like, come on, man, make your mind. What are you gonna do? Because I was looking at the Instagram, and I was seeing a lot of guys that were doing the LON femur, and they're getting like 10, 11 centimeters. And I really liked their before and after pictures. I was like, wow, the results look good. But then I was thinking, I kept thinking over and over and over again, like, man, what should I do? I mean, I was scared, to be honest, too, because if I do a quadrilateral, what about, a lot of other surgeons were telling me like, no, that's too much.
Yes,
or,
exactly.
you might not walk well. Your results might be pretty bad with your recovery. So I was kind of going back and forth, like, I don't know what to do. I'm kind of like, what do I do? Because, like, saying, I was thinking, well, you know what? I want to be proportionate too. I don't want to really have a long femur, and then I'm not really happy with my tibia. So finally, I just kind of put a lot of thought into it. Actually, I saw Michael, and I thought that, you know what? It looks more proportionate if I can just do both, and I don't want to go through a second surgery. So let me just do the quadrilateral and just get it over with. So It was kind of tough, very tough decision, but I thought quadrilateral would be the best investment.
Well,
Yeah, for my goal.
okay.
And that's actually a question I have. I noticed that a lot of centers are very modest and conservative with how much lengthening they will allow a patient to do. So I'm just curious, like from your standpoint, I think I know the answer, but like what helps you all to feel so confident to not box patients into just certain restrictions, if you will?
I mean, the question is about the quadrilateral, right? So.
Well, not just the quadrilateral, but just in general, like other centers that I talk to, they say, well, we will only allow a patient to go 3 centimeters, 4 centimeters, 5 centimeters, or what have you.
Bro, this is a good question actually, because it's also something people ask me about the quadrilateral or the centimeters. So I mean, I'm not a doctor, so I'm also a patient like you guys. So here we have a doctor, here medical doctor. So I mean, first of all, doctors who's not doing a lot of limb lengthening surgeries and doctors who don't have like the enough equipment. So what is the enough equipment? For example, the rehabilitation. So I mean, if I do the surgery as a doctor and let you go home, so this is something, I don't know what you are exactly doing at the home, okay? So no medication management, so you are taking medication, no really professional physiotherapy or any analysis, you know, so, and it's just a random lengthening. So in that case, me as a doctor, like I also would recommend to you not go for maximum, or I would say not do quadrilateral, because then it's quadrilateral risky. So because I have to also protect myself as a doctor, right? And guys, very important, none of the doctors in the world, Michael knows, will say to you, I'm sorry, I cannot recommend you to quadrilateral or do the quadrilateral or do not, or you can reach 10 or more. So because none of them want to take responsibility for sure, and also none of them will say I don't recommend, because there's also a doctor ego, you know. They will not say I don't have the experience to do the quadrilateral, or I don't have enough equipment to offer you the 10 or more. They say I don't recommend as a doctor. So that's the typically answer of a doctor, I don't recommend, because we have to also accept that. I mean, yeah, it's a doctor, they have ego, and also they have to protect themselves as well. Imagine, so when you ask me, should I do the quadrilateral or not? So, and I'm a doctor, so I will not say, bro, sorry, I never did quadrilateral before, I don't know. So then you will lose your trust in me, right? So I will say, hey, as a doctor, listen, I'm a doctor, so I don't recommend you to do the femur or tibia, or I don't recommend you to go like more than 10 centimeter. For example, Damian, how much centimeter you reach, bro?
11.6.
11.6. So for some doctors, it's impossible to reach 11.6 from the femur, you know, or risky, or he can never walk again as before.
Then
so
we like to show other people what's possible. Actually.
Yeah,
it's very impossible.
Absolutely.
Yeah.
I mean, there's a lot of doctors here, a lot of places, so they are just, I mean, different experiences for sure, and they are thinking different. But we as Livelifetaller, of course, bro. For example, we are doing a lot of surgeries, different patients, different body anatomy, different ages, different methods. For sure, we have also complication. Another topic, complication, for example. Complication is also some complicated thing, you know, because to fix the complication, you need experience as well. And what is the experience? You have to see complication before is the experience, you know. So imagine, like, if you will, our first complication case, so it's really hard to fix that, you know, so we don't know exactly how to fix it. Yeah, complication is also another different topic. That what you ask is also different, you know. I mean, for us, it's as long as the body aloft, as long as everything is fine, bone healing is good, no infection or no problem. So of course we can try the maximum, and we can do the quadrilateral because we believe in us and we have the experience.
And that's the reason I chose Livelifetaller, because when I did the research, many of them didn't recommend it or offer it at all, right? So like for me, I knew I wanted to do quadrilateral just because of time, right? Like I don't have like, you know, I'm married, I got 2 kids, like they're busy. So like it was such a big burden to leave my wife taking care of the kids. At the same time, a business that I'm trying to run, right? So I don't have time to like leave, go to this major process, and then come back to recover, and then come back again. Yeah, I just didn't have time, right? I just wanted the least amount of time with the maximum benefit, right? So like, I don't mind going through a little extra pain, going through surgery, both surgeries at the same time, just knock it out all at once. And I think I don't have any doubt that's the route to go personally. It's just because like I'm trying to work here now from like 8 p.m. to like 2 a.m. right? So like it's like I can't do that multiple times, right? It's just really hard. So like it's just been easier doing one time, knock it out, and then come back home.
Hit two birds with one stone, yeah?
Exactly.
Quite literally, right?
It's just way faster. And you're gonna have to go through surgeries anyway. You're gonna have to go through recovery. Like I just don't want to go through it twice. It's just so much pain I had to go through or discomfort. I just want to get it done and move on with the life.
And for example, I also want to ask you something, bro. Doctors told you like don't do the quadrilateral, right? So like it's risky, 2 surgeries in one surgery. So how comes to choose the quadrilateral?
Why did I choose quadrilateral? I mean, doing my research, this surgery is new to me. So the only thing I could go by was looking at your guys' prior clients who done the quadrilateral, and I was someone like Michael. I was like, wow, he looks like he's moving pretty good. I watched the interviews. He looked like his recovery was going well. So, I mean, even though I talked to the other doctors and they said, it's pretty risky to do the quadrilateral. If you go over 8, you're putting yourself at high risk. It made me think like, okay, well, maybe of course, naturally worry because I am a person that is a pretty active person. I'm a trainer. I run a business. I'm a realtor. So I was worried of course, wow, it'd be nice to get the height, but then what about if I sacrifice my mobility, my movement? So of course I just look at your prior patients. They look like they're doing pretty well. Then lastly, I just kind of had the confidence in myself. I knew that I could do the rehab. I knew that I could do the stretches. I knew it was going to be tough. And then I also had more confidence that you guys had your facility, your team, your physical therapy team. So I was like, okay, I could do this, and I can live there for 3 months. We could work with the physical therapy team, and I got the confidence that I'm gonna do well after it's over with. And that's when I went with you guys with that choice.
All right, thank you, bro. Carlos and Nan, what about the quadrilateral decision? Because you came for the quadrilateral first, Nan also for quadrilateral. Are you happy with the decision of the quadrilateral?
Well, personally, I am, because as everybody else kind of explained, the quadrilateral, it's kind of designed to maximize your gains of centimeters in the shortest amount of time. So that was the main reason why I picked the quadrilateral initially. I thought about doing separate surgeries prior to making that decision. Doing the femur first, LON, try to do what you get the maximum out of the femurs, and then come back maybe 6 months later, a year later, and then do the tibials. But I thought about the time, just like we said, the time, with the family too. Most of us have families. And it just didn't make any sense to go through this twice, get to Y here again, and move on. It didn't make any sense to go through this twice at that time, okay? But, so that was the main decision why I went with the hybrid quadrilateral. My goal was to be 15. Functionally, felt a little bit short. When I say short, that's 3 centimeters. Doesn't seem like a lot, right? That's a little over range, but with the handbra reticular bone that I had, where I wanted to be 6'3", but it would take 6'4" in a day, of course. So falling short that first surgery, going home, and then just kind of thinking about it little by little. Once all the pains and everything went away, of course. It's kind of like when you go out and you drink a lot, the next day you have a hangover. The last thing you want to do is drink again, right? But once you get over that period, you start thinking about it again. Same thing with the surgery. So start to think about I'm 100% happy yet, because instead of being 6'3", 190, I'm only 6'2". And I know it sounds crazy, right? 6'2". You know what? There's thousands of men out there that would take 6'2" in a linear second, right? You, everybody, but there's somebody that doesn't have 6'2". That's nowhere near the 6'2", right? But when you're 6'2" and you wanted to gain a little bit more, like in my case, 6'3", 6'4", so it says, I'm sorry, but I told my wife, I started talking to my wife about it. So it's phrasing. You know your phrases.
Yeah.
Oh, so I explained the whole thing. So little by little, I kind of, got her to believe in me again. I says, sorry, this is something that I have to finish. This is unfinished business that needs to be taken care of. And I'm the type of individual that, once I start something, I have to finish.
Very good.
And that was bothering me constantly. It was bothering me almost as much as the initial pain that I went through for years before I knew that I would even do the surgery. So now here I am again. This time it's being more sensible. Of course, as you know, I picked the Fitbone. I wanted 6 centimeters. I'm actually probably already there. But I kind of decided to go for 7.5 like 3 weeks ago. So, I don't feel like peace.
Okay. You also increase your goal?
Yes, but not by a lot.
You'll be close to Michael, by the way, right?
The only reason I'm doing that is because I still want to be 6'4", as I told you from the very beginning. 6'4" is the ultimate goal. In order to be 6'4", as Michael explained, the X-ray measurement is not the same as your vertical measurement. Okay? So that's really, in the morning, you might be, for example, if it's 199.3 or whatever it is, one knee, and he might be 198.1, right? So you lose a little bit, okay? So therefore, in order to compensate for that and to make sure that I'll be a barefoot 6'4", I gotta go 7.5.
I mean, can I say something about that, about the X-ray? This is 100%, bro, 100% because of the back. Because we have also the ortho X-ray before the limblengthening surgery. We did the ortho X-ray before. And also, once we are done, we will do another ortho X-ray, right? So then we can check the whole length. You will see, yeah, of course, I mean, X-ray can change 3, 4, 5 millimeter at least, right? But not more than 5 millimeters. So I cannot imagine that. So it's really because of the back. I mean, if you can really straight, 100% straight, if you strengthen your back muscle, so you will not really lose on centimeters. So it's my opinion, and it's really like that. So, but yeah, let's check it.
It's never a bad idea to just,
of course,
if you can,
of course,
always remember, if your pain allows you to do that, if you're not too tight, if you have the time, all of those factors, roll into one. Why not just do a little bit more if you can?
It's like with money. Better to have too much than too little, Always to be better on the other side,
And in my case, all of these 3 factors are good for me right now. That's why I'm going to be able to push that little extra 1.5.
As long as you can do that, why not? All right, thank you, bro. So now lastly, I also will ask Nan about the quadrilateral. Then I will ask my brother Damian, so how is your life? How is everything? And lastly, I want to show you something about the Fitbone method. I just want to give my honest opinion about the Fitbone method. But yeah, so Nan, what is your opinion about the quadrilateral?
Definitely quadrilateral for me because, the proportion is so much better. And time, I have no time. Work, you had to take away 8 months. I'm going to be off work for 8 months. So that's a significant time. Can't imagine doing another surgery and going through another pain. But at first I thought, your body cannot make that much calcium because, you're doing quadrilateral, so you do 4 bones and then your body have to make, calcium for bone healing in a short amount of time. So it's not it's not safe. That's what the doctors in where I went said. So I thought, oh, it's not safe. But then after watching all the videos, all the patients who had quadrilateral, and it's safe. And you got the nutritionists here to help you. I got supplements, and you still have the inside nail to support you. And with LON, I believe that it's quite strong. So when I'm going back to nursing my job, I feel quite active. So I don't want anything that happen mishaps and break my nail inside. So I'm really happy, that I chosen the LON. And talking about complications, this surgery is not easy. It's going to be a tough journey. It's going to push you to your limit. And but if you want it, it's safe. It's a safe process. And I wouldn't want to be anywhere else other than LLT. You got a whole team support you. You got medical team. You got nutritionists. You got physiotherapists. You know, a CEO works so hard on me to get me where I am today. I don't think I'll get 14 without her. So it's like a whole team, and you know they respond so quickly. You know, and the team is so well communicated. They communicate. So I was so amazed. You know, if I had a slight infection or anything, everyone knows. If I didn't sleep last night, someone knows. You know, and everyone knows. So it's the communication between all the team in LT is so amazing, and you got the support. So it is the safe process. And you wouldn't want to be anywhere else because it's, you know, you get so supported. It's going to be painful, or it was very painful for me, but you know, you're supported.
I appreciate it. Thank you so much, Anand. So lastly, I want to come to my brother, because you are the only person I can ask.
You kept the best for the last.
Yeah. I mean, he did 11.6 on the femur, which is for some doctors, some patients, impossible, risky. You can be never walk as before. You will be never the same person as before.
No, we don't listen to those stories. I mean, I do remember actually. You do remember I traveled even 1 year before the surgery to check everything. You know, I'm a very methodological guy. Had to make sure everything was right. And I remember even at that point speaking with some other patients, and they said, yeah, 8-9 centimeters is like. Max 10 is like a dream, and you know, I don't listen to those stories, you know. And yeah, but I mean, my journey was extremely smooth, and it's, as I told you, right, because I listened to you, I prepared very well, and that's why I came 1 year before, so I could create my own protocol and routine of like preparation before coming here, and I think that's what made it, you know, super smooth. I remember, well, you remember as well, I mean, I left 1st of April of last year without crutches. And I, you know, started walking ever since. I never used the walker or the crutches, and that definitely made my recovery much smoother. I do remember in June of last year, I traveled to China, and within 4 weeks, I walked. I had it tracked, 240 kilometers.
Oh my.
Yeah, of course, every day, you know, you count out those steps, and I think that's also what contributed to like great bone healing, absolutely zero complications, and people often, you know, because of our platform, they often message me about all sorts of complications. And I mean, I'm not gonna lie to them. I'm not gonna make up a story that doesn't exist. I simply had no complications throughout the process or after the process, but it's because I listen to the people who know more than me, and I prepare very well myself. And so.
You have still the nails in your bone?
I do, yes.
Do you have any restrictions, bro? So
No.
No restrictions?
When I started physio after returning back to my home country, of course, you know, the thing that I did spend a lot of time in my physio is basically stretching, so I could sit on my heels. That took some work, but no, I mean, actually, the more I invested in physio, especially after going back home, after like, you know, fully recovering, I could see progress pretty much instantly, yeah. Because here it's obviously, during the lengthening, you support the soft tissue and the process, but the work really continues as you go back, you know. And you know, you do have to integrate physiotherapy within your daily workout. And yeah, you know, I was always an active guy, so yeah.
That what you did, like 11.6
was a record, you remember?
Yeah, I know. So is it really worth it? I mean, it changed your life, bro? Can you feel it, or?
Yeah, I mean, definitely, as I was telling you, it was like one of my life's best decisions. I could have pushed it. I believe I could have pushed it to like 12, maybe 12.5, but I do feel like 11.6 was like was a good place to
absolutely.
find. Although, you know, I have some thoughts, and you know which ones, you know, the future. So we'll see. But I mean, I cannot imagine a universe in which being shorter is better than being taller. Absolutely. I'm sorry. I mean, and if, you know, I encourage everyone who wants to do it to give it a shot. Of course, you have to prepare, and you have to go in with the right mindset. I do remember one day before the surgery coming to the clinic, and I met a patient who wasn't the most optimistic about life, generally speaking. That was his attitude, and I remember he told me, prepare for hell. I was like, nah, and it was very smooth throughout. Of course, the sleep. I mean, the sleep, I'll never forget the sleep. Yeah. Obviously, with LON, you have to sleep on your back. Oh my goodness. I mean, I remember tracking absolutely everything. And my stats throughout that period was that I slept an hour and a half per day, and it was like, well, you couldn't call that a sleep. It was like just, you know, lying in bed, like staring into the abyss of, you know. But after that, after the LON removal, I slept like a baby. I remember sleeping on my side the first night. I was like, oh my god, this is wonderful. Yeah.
Bro, for people who are interested in like, I'm 100% sure, so when they see the video, they also will like reach more than 10 centimeters.
Yeah.
What will be your recommendation? Do you recommend that to do more than 10? Or do you recommend to split the lengthening? So what is your opinion about that?
That's a tough question. You know? I think it's very individual. It's a bit like people come to me and they ask me, is it painful? Because we have the Livelifetaller community. Yeah. A lot of people ask me. It's a digital platform where we advise people, where people can ask questions, or we can connect as patients and people who want to be patients one day. And people do ask, you know, is it painful? Is it tough? Pain is very subjective. Okay. You know, it really all depends largely on what you have experienced, what you had experienced previously in life, right? For some people, it's gonna be easier. For some people, like Carlos, it's gonna be an easy job because, you know, I'm sure you've gone through a lot of tough things in life, and that gives you the energy you've got, and you can see that from the outside, you know. And I think it's very individual. For me, the decision was I could have done quadrilateral, but I wanted to first give it a shot for femur. You know, I have great geographical mobility thanks to my businesses, so I knew that if I want, I can stay longer and just do the TBS afterwards. But yeah, that's the path I chose, and of course that was, well, remember that was before the Fitbone. PRECICE, as we both know, was sometimes tricky, and so I did trust the LON method on the balance of probabilities of risk. I trusted it more, so I thought, okay, let's do LON.
That was the reason why you chose the LON.
Yes, mostly that, and I also knew that with LON I can maximize. With PRECICE, you do have certain limits you can't exceed, and so I thought, okay, if the only thing differentiating the two is maybe slightly larger scars, like I take that risk.
I mean, guys, imagine we had also on Damian's time, we had patient who was just reached 7 on the femur with the LON. So in Damian like 11.6, Damian was 10 times better, in a better condition than a patient who reached and finished at the 7 centimeter. It's like really not about centimeters sometimes, it's also about the patient. So
I think it's about the preparation, and I think it's about the mindset, about the protocol, the routine. I mean, you know, people come here with different energy from different life paths and so on, and that's perfectly fine, but I think you can almost from the start kind of see what energy people come with, and yeah.
Bro, thank you for your motivation.
No, of course. I mean, I'm just telling the truth. You know?
And
thank you for implementing this vision, because we wouldn't be sitting here if you hadn't gone through a lot of pain yourself at your own home without this clinic. So thank you.
Thank you, bro. Also, without your trust, guys, so we also couldn't sit here. I know it's not so comfortable for you guys. Just lastly, I want to show you the different nails. Can I have the nail? So just, I will show you something, guys. I mean, this is the PRECICE nail, by the way, which we remove. It's the original nail. It's not a demo version. So this is a LON nail, which you have, and you have, yes, and you have. And I had that also, I removed it, by the way. And this is the Fitbone. So the PRECICE nail, this is the biggest PRECICE nail. It's 12.5 millimeters. The diameter is 12.5. The LON nail is 10 millimeter. And this is 11, the Fitbone. By the way, this nail is Quark's nail. We remove it, yes. I mean, the Fitbone is really, really strong nail, bro. You can also, if you want, you can touch. By the way, we clean it up, so no worry. I mean, it's really, really strong. And there's some questions about the Fitbone, you know, should I exchange the nail? So because when we did the PRECICE, we recommend to patients, say, please exchange the nail, because unfortunately, we didn't trust, Damian knows, we didn't trust the nail really, so it was not that strong, unfortunately. So maybe you can also have. But for the Fitbone, you guys asked me also, should I exchange the nail? It's not needed, so and I will show you guys today how strong Fitbone is. Okay.
I'll do it on the leg that was lengthening.
We try. I also never see. I mean, because some people, for example, PRECICE, Michael knows it's really sensitive, especially if you rotate your legs. So, LON is really strong for rotations, and Fitbone also. I mean, the Fitbone company says no rotation, no problem. So it's really, really super strong. I mean, it's even stronger than the Max. So, just they are mentioned, of course, to not like walk without support. I mean, I also would protect myself as a company. So can we try, please? 105 kg. It's just like over 200 pounds, right? Okay, this is the Fitbone from like Quark's nail.
From the weaker area we're pressing right now. This is the area we're pressing right now. This is the stay on one hand. You can take
Sedat, with the back, please here. Yeah. Try. You see, bro?
bending. We're pressing from the weaker part. We are not pressing from the top or down. Here is the weaker part. Also.
This is crazy, bro.
Now, with all my power. I will
And
push.
this is 11. The biggest is 13.
So I'm at 11. These guys have 13.
13.
Yeah.
Okay, you have the 14 also, right? Yeah, 14. Yeah, it's the same. It's super strong.
Like a magic wand.
Bro, it's designed really, I mean, the design is really good, technology is really good. It's crazy. That's crazy. It's crazy. You see?
I take it for later.
I mean, you guys can see no bendings, 105 kilogram. So, and he was jumping on the nail. So no bending, nothing. So it's really strong nail. I mean, for the questions, you really don't need to exchange a nail. I mean, it's really strong. But to be honest, this is also the fact. For example, there are strong, super strong nails, which is, Michael knows, which is fully weight bearing. I mean, which allow you to have a weight bearing. For example, LON nail, we say to the patients, according to company instructions, patient can walk with full weight bearing. Or there's another different
I was
nail
even
of them.
dancing. You remember? Yeah,
I know.
I was like, yeah.
But the problem is, bro, fact is, even it doesn't matter how strong or how weight bearing the nail is, you can, even if you want, you cannot walk without weight. Like, because, you know, once you are finished with the lengthening, you walk like, you know, like you limp. And nobody wants to walk outside like with like limping, in a limping style walking, you know. And also your muscle are like really tired.
Because at the end of the day, it's the procedure you gotta go.
I know, yeah.
No one in the world is gonna walk from day one
Exactly.
after the surgery. No matter if you had the strongest nail ever designed, you gotta go through the process. You gotta start with your
I'd like to say 3 days after surgery, I was walking, after removal.
Yeah, he's a,
I have the video.
he's a different example. by the
Okay,
way.
I'm a different animal. Yeah.
I mean,
But I think you can push it within like,
Yeah.
where you can like walk within few weeks.
it's just like I kind of consider myself a bit of an example, a good example, because I'm generally much heavier than most of the patients that come here, and yet they have no complications. We need one.
I think it's the internal energy.
Yeah, it's the genetics at the end of the day.
That's what I think, yeah.
Absolutely. All right, thank you guys. Thank you for this nice video. I'm
I
sorry.
think no.
I know it's
Well,
not comfortable for you.
Thank
guys.
you for creating this place and obviously for allowing us to realize our dreams,
Pleasure.
because it wouldn't, you know, exist and it wouldn't happen without you. So.
Pleasure, bro. My biggest problem was my height, and thanks God, I fixed that, and now I'm really happy to see. Yeah. Thank you.
I actually mentioned something I bet you in one of the videos where I said that, you know, he could have been selfish. You know, he did these 3 procedures, got his limblengthening. He could have just did this with his hands, walked away, and not looked back. But then he decided to create this clinic. You know, brought us to this great doctor, Halil Buldu, who did your surgeries, right? So together, you guys put this this whole thing together. If it wasn't for you guys, like he said, none of us would be here.
Yeah.
I'll be honest with you. Without this particular clinic, I don't think I would have got anywhere else. So, you know what I mean? Thank God for
I
you.
appreciate it. Thank you so much, Carlos. Thank you for your amazing words, bro. Thank you. Thank you, guys. So, and yeah, and I'm happy to see soon the result of you guys. So, Michael is finished, and you are also close to
I'm
finish
close.
one also.
And I just appreciate because like you want to be very transparent, right? Like with the videos, it's not always positive, but you told me, hey, be honest, tell them about your complications, because I like watching the videos and see what to expect, right? Like I want to know that not everything is just roses, right? Like if not everything is perfect, right? Because there's gonna be people that will have complications, but at least you're prepared for it, right? Mentally ready for it. So it's nice that you don't want to try to hide and say, hey, Quan, don't say that. You're like, Be honest.
Yeah.
Tell people what you went through, because I think it might help other people.
Yeah. Thank you so much, bro. Thank
There's
you.
always inherent risk in anything we do, so
Of course. I mean, nothing it's easy, nothing it's, you know. It's
no free
like
lunch
that.
in life.
Exactly, bro. You have to fight for everything and...
It would be great if everybody was like Damian.
Yeah.
Or I don't want to say myself, I guess, because I had no problems. Well, there's been a lot of other patients that haven't had any issues either. But, you know, there's also has been quite a few patients who have complications of this quad and many others. Yeah. So they just have to prepare themselves, you know, the future patients, of course, anybody is watching, you have to prepare yourself mentally, physically, emotionally. And if you happen to be one of those patients that has a complication, just be strong. They're here to help you. They're never going to turn their back on you. And
They'll face it.
yeah, they're physically there. I mean, how can you go wrong? I mean, the only way that this could go wrong is if you happen to be doing this surgery somewhere else. So, I mean,
And that's why we created ltcommunity.com, right? So for people to basically be able to prepare, to read resources that will prepare them better, and also to take them through that journey. So I think, you know, it's great that you have such inspiring patients that fit Carlos with his new methods are on with our platform. So yeah, that's good.
And you called me at 11 p.m. at night. You were in bed.
Yeah, of course.
I mean, when he knew I had to do his third surgery, he called me personally, and it was like more of a personal human touch, right? I mean, you didn't have to do that. You could have just, you know, told me the next day, but you knew it was important. You know, I was waiting. You called me and told me. And I mean, that's the biggest thing too, right? It's not just for you making money, it's for you to do it right. Right? You stand behind that.
For sure. I mean, it's my job as a human, bro. It's like, you know, it's not only something about surgery or business. For sure, it's my business, yeah. But you have to stand also behind, not as like a professional man, also like as a human. I mean, if you need me, I'm here. So it doesn't matter how far you are or, you know, so no problem. And it's really also for me nice to see the different stories. For example, 11.6 on the femur, respect, or 3 times the surgery. I mean, close to 30 centimeters, really respect. So, and I thought I'm like the guy who have the record and, you know, 3 limblengthening surgeries. But when I see you guys, it's like just, I have respect.
oh, you're the inspiration.
Exactly, you started the trend. We are just continuing.
Yeah, but you guys made it better, you know.
None of this would be possible.
Exactly.
All right, thank you guys. Thank you so much, and thank you for your time, for your amazing time and important time. Thank you so much. Yeah, so I'm really happy, and guys, see you in the next video. Bye bye. Thank you, bro. Thank you, guys. Thank you.